Okay, guys. Hi, this is Dr. Sean, and we're at Fortis. It is week 6, and we're getting towards the end of the week, but I just want to give you guys a chance to run through with me how to do and get some hints on the week 6 assignment, the reproductive system. It's like 9 things long, so it's kind of big, and I'm going to go over it on a few different screens here. Let me fix a couple things for me. There we go. So we're going to look through these, and you go through this list over here. Can you see my? There we go. There's my what's that called? My cursor, and we're gonna go over all this stuff. I'm gonna do one section at a time. We're only gonna do a few of these because I don't want to do too much time on this. But let's go through the beginnings right here. Male gonads. Gonads are the things that make you male or female, right? Female gonads are ovaries, and male gonads are testes. They're called testes. Structures that produce sperm and secrete testosterone. Um, that's weird because it gives you the answer right there, and the answer is testes. So we're gonna roll up here. I get to that. Jeez, I hate doing this stuff. It's kind of hard to do on here. Let me make it smaller even. Gee whiz. Okay, there we go. So we're gonna go testes is the first one, right? Second one, cells that secrete testosterone are the interstitial cells. Those are of the male, right? Those are in the testes themselves, and that's what gives males testosterone. Females make it too, but not as much, right? Males make much more. The male gamete, mature gamete, is called the sperm cell. That one's right here, and all you got to do is drag and drop those things, right? Female gonads, and now we talked about that one, is the ovaries. I guess we would say just ovum, ovaries. It should say ovaries. There we go. Ovum is the egg. Ovaries are what hold the egg. Now, those are two little almond-shaped things, and they're about the size of an almond, not much bigger. And you got two of them, right? There's one on the right and one on the left. And traditionally, at least in acupuncture theory, there's actually an acupuncture point on the ankle, inside the ankle, that when you press it on either side, one will be more tender, and that's traditionally known as the side that you're ovulating on. You don't pop out eggs on both sides every time. Sometimes that happens. You can end up with paternal twins, right? Not identical twins. Identical twins is one egg splits, two eggs would be a paternal twins, right? The next one, the vas deferens, which is, it means the big difference, similar to the fallopian tube in the female, but for the male, it's called the vas deferens or the spermatic cord. Uh, joins the duct of the seminal vesicle to form the ejaculatory duct. Okay, that's where everything comes out. Oops, where is it at? Ejaculatory duct, put it right there. Bonk. Good. Now we only have a few of these left. Notice how it tells you which ones you've already done. Now the cool thing about this is you always have more attempts. You can retry it, right? And that makes it much easier. So if you're getting down to the wire, this is a hint for some of you. Go ahead and just like put them in there. Put them in there. Read through them real quick and put them in there. You don't have to think about it. Just put them in there and see what you get. You might get some points. Better than a zero, right? On those kind of things. Be better if you, of course, look through it, right? And try to get better. Sac or pouch located between the thighs and holds the testicles. That's going to be the scrotum. Now, it's kept outside because you want to keep the testes at about 1 or 2 degrees lower than body temperature, 98.6 Fahrenheit, and that makes sure that the sperm can actually be made and survive. So things like hot tubs and hot showers and tight fitting underwear are one of the things they would say to men who are trying to conceive and have a low sperm count, right? There we go. Name for the penis and the scrotum. Uh, what? The penis, external genitals? Duh, that's kind of easy, isn't it? Right? As opposed to the internal ones, which we really don't have, right? The internal parts would be the vas deferens and the prostate and stuff like that, which is different. Undifferentiated spermatogenic cells or spermatogonia. Okay, so we're going to move that down there, right? And the what's this? A coiled structure that sits on top of the testes inside the scrotum. It's a little squiggly thing, place where sperm mature. That's called the epididymis. Now, for example, here's some hint stuff too. If you're a male and you're getting into some heavy petting and some other like sexual stuff, you can get what's called blue balls, which means that the epididymis starts to fill up with those sperm cells and it's getting ready to send them out, right? Because it's expecting everything's going good, but then nothing happens and you get congestion in that area. It can be very uncomfortable for males. A tubular structure that carries both urine and semen, that's going to be your urethra. In the female, they're separated. The female urethra is obviously separated for that one, okay? Female urethra is like this long, male's urethra is longer. Male copulatory organ, that's going to be the penis. And the composed of a head, body, and mid-piece. Now, mid-piece is what gives it away, and the tail is the sperm cell. Oops. Sperm cell. There we go. And the female gametes is called the ovum, as opposed to the male one, which is called the sperm. Right? Male and female. Preface: the piece of skin is piece of skin that is circumcised, also called the foreskin. Skin. I don't know why it says it like that. That's really kind of crazy, but that is called the prepuce. So there we go. That's our part 1 of the reproductive week 6. Okay, so we're going to label it that one. I'm going to give it to you. There we go. We'll go through the other ones here in a couple minutes. There we go. See, we did good. Let's end that one here, and we'll just give you, see, 5, almost 6 minutes just to do one. Anyway, talk to you soon. Don't forget to do the rest of your discussions. Respond to 2 other people. This week is the end, so I'll be doing the grades on Friday, probably Saturday, and make sure you get everything in, and we'll go from there. Talk to you later. See you later. Bye.